Hello, everyone. I'm Vidya Vedham, Program Director at the NCI Center for Global Health. I'm here to provide an overview of our RFA to support implementation science for cancer control among people living with HIV in low and middle income countries. As of 2019, there are 38 million people living with HIV worldwide. Of these, 26 million people have access to antiretroviral therapy, ART. 90% of HIV positive individuals live in low and middle income countries. In LMICs, HIV infection has now become a manageable chronic health condition due to increased access to ART and innovative approaches to service delivery, such as community-based decentralized models of care and task shifting that has led to increased lifespan among people living with HIV. With increased access to ART, the aging HIV population bears the burden of associated health conditions, including non-communicable diseases like cancer. Although there are evidence-based cancer control interventions available for HIV-positive populations in high-income countries, there are unrealized opportunities for translating this evidence to benefit HIV-positive populations in LMICs. Such opportunities include leveraging and building on community infrastructure for HIV treatment and prevention to promote the uptake of evidence-based cancer control interventions, integrating or bundling evidence-based cancer control interventions into HIV treatment and prevention programs that engage remote and vulnerable communities, developing or adapting innovations in telemedicine or mobile health to improve the uptake and reach of evidence-based cancer control interventions for HIV populations. We believe that implementation science is a powerful tool to realize these opportunities by developing and testing strategies that increase the adoption and sustainability of evidence-based cancer control interventions into practice. So what is implementation science? Implementation science is the study of strategies to promote the adoption and integration of evidence-based interventions in a variety of settings to improve the impact on population health. By interventions, we mean programs, practices, or policies that have been empirically demonstrated to improve health. By strategies, we mean methods to enhance the adoption, integration, sustainability, and reach of these proven interventions. We all know of the 17-year gap for only 14% of original research findings to reach patients in the absence of implementation strategies. This analysis was from high-income countries, so you can imagine that the interval is indeed longer and the uptake lower in LMICs. Therefore, implementation science studies can help us identify implementation barriers, develop and test strategies to overcome these barriers, and determine the most effective ways to scale and sustain these implementation strategies. Despite its potential importance for bridging these evidence to practice gaps, there are limited studies on implementation science for cancer control, especially for HIV populations in LMICs. Therefore, the goal of this RFA is to support the development, adoption, adaptation, and testing of implementation strategies to deliver evidence-based interventions, tools, and technologies for cancer control among people living with HIV in LMICs. The RFA aims to stimulate high-quality applications and support a cohort of UO1 Cooperative Agreement projects in this priority research area for NCI. Application budgets are limited to $500,000 in direct costs per year. Let's talk eligibility. This funding opportunity is open to both domestic and foreign institutions. However, the research must be conducted in LMICs. So how do we define LMICs? LMICs are defined according to the World Bank country and lending groups and is inclusive of low and middle income countries and upper middle income countries. Then there are all these registrations for NIH funding opportunities. So let's go through them one by one. All registrations must be completed prior to the application being submitted. Applicant organizations must complete and maintain the following registrations as described in the SF 424 application guide to be eligible to apply or receive an award. Registrations can take up to 6 weeks or more, so applicants should begin the registration process as soon as possible. A quick reminder that the NIH policy on late submission of grant applications states that the failure to complete registration in advance of a due date is not a valid reason for late submission. All registrations require the applicants be issued a DUNS number. After obtaining a DUNS number, applicants can begin both the SAM and the ERA Commons registrations. The same DUNS number must be used for all registrations, as well as on the grant application. Applicants must complete and maintain an active registration, which requires renewal at least annually. The renewal process may take as much time as the initial registration. SAM registration includes the assignment of a commercial and government entity cage code for domestic organizations which have not already been registered and not already been assigned a cage code. Similarly, foreign organizations must obtain an N cage code in lieu of the cage code in order to register for SAM. Applicants must have an active DUNS number to register in ERA Commons. Organizations can register with the ERA Commons as they're working through their SAM or grants.gov registration, but all registrations must be in place by the time of submission. ERA Commons requires organizations to identify at least one signing official and at least one program director or principal investigator account in order to submit an application. Applicants must have an active DUNS number and SAM's registration in order to complete the grants.gov registration. I completely understand that this is a lot of information. If you're a first-time applicant, please do reach out to me if you have any questions, clarifications, or need additional information after this webinar, and I'm happy to help you through the process. The scope for this call is to support implementation science to accelerate the integration of evidence-based cancer control interventions for HIV populations into the healthcare delivery infrastructure for HIV treatment and prevention. Applications should identify, understand, and develop strategies to address barriers to the adoption, integration, and sustainability of the interventions across the cancer control continuum among HIV populations in LMICs. We encourage studies to use existing models, theories, and conceptual frameworks of the implementation science process, adapted to and evaluated within the context of local care settings and accommodating the needs of multiple stakeholders. Research may also include testing strategies to scale up interventions which are sustainable and feasible across multiple resource-constrained settings. Applicants should generate data in LMICs that can inform effective and equitable implementation of evidence-based cancer control for HIV populations worldwide and should include multidisciplinary teams of researchers with expertise in HIV, cancer, and implementation science. So based on the scope of this, the following types of studies will be considered non-responsive because they are not in scope. Projects focus primarily on the development and testing of new interventions, including studies primarily focused on evaluating intervention efficacy. Projects lacking key personnel from LMICs with substantial involvement in the research activities. Projects utilizing interventions for which an initial proof of concept has not been demonstrated in a relevant care delivery system, and projects that lack clear potentials to move the proposed intervention, policy, or practice towards scalable and sustainable implementation within the LMIC context. Based on this, we have additional standard, in addition to the NIH standard review criteria, reviewers for this RFA will be asked to consider the following additional criteria. Does the proposed implementation science project address the unique public health needs of the LMIC population? Is there adequate expertise in HIV, cancer control, and implementation science across the investigator team? Does the team's expertise highlight sufficient knowledge of the social and cultural context of the LMIC setting with appropriate adequate participation and leadership by LMIC investigators and or key personnel? Does the research team include strong partnerships within the LMIC institutions, including relationships with diverse LMIC stakeholders? Are the applicants well positioned to disseminate study results such that they can inform broader scale up and sustainability towards significant public health impact in LMICs? And lastly, do the proposed approach take advantage of unique strengths of the HIV care delivery environment? Based on NIH HIV/AIDS research priorities and guidelines, all projects must address the current OAR strategic goal to promote dissemination and implementation of research discoveries for public health impact globally. Investigators must include focus on an HIV population and include additional information about research population, HIV context, and any related measures. Next, let's talk about the U01 Cooperative Agreement. It is a funding mechanism used when there will be substantial federal scientific or programmatic involvement. Substantial involvement means that after award, the NIH scientific or program staff will assist, guide, coordinate, or participate in project activities. Under the Cooperative Agreement, the role of NIH or NCI is to work in a partnership with the award recipients to support and stimulate their research. It is not to assume direction, prime responsibility, or a dominant role in the activities. Consistent with this concept, the dominant role and primary responsibilities therefore resides with the awardees of the project. The specific tasks and activities for the awardees and the NCI staff are listed below. The PDPIs will have primary responsibility for the following: defining objectives and approaches, including study design and protocol development, overseeing study conduct, including data analysis and interpretation, quality control of studies conducted under this program, and publication of results. They also will participate in cooperating with NCI programmatic, technical, and administrative staff and administratively manage the U01 grant. Awardees will retain custody of and have primary rights to the data and software developed under these awards, subject to government rights of access consistent with current DHHS, PHS, and NIH policies. Investigators are encouraged to organize and participate in joint meetings and workshops, organize collaborative activities, and participate in scientific working groups. NCI staff will have substantial programmatic involvement that is above and beyond the normal stewardship role in awards as described below. One or more designated NCI program staff will have substantial involvement as project scientists in the awards under this OR. The specific roles of the substantially involved NCI staff members include monitoring the progress and performance of the awardees, participating in the activities of the program steering committee, facilitating collaborations between the awardees and other NCI-sponsored programs, investigators, or organizations, and helping the coordination of such efforts towards the project's goals, reviewing all major transitional changes that the awardees might propose, and providing technical assistance and advice to the awardees as and when appropriate. Additionally, the program steering committee will serve as the primary governing body of the U01 program. The steering committee will be jointly established by all the awarded PDPIs and the NCI program staff members. The program steering committee consists of 2 representatives of each award, the contact PDPI and the designated backup senior investigator, 2 NCI project scientists, including a representative from the NCI Center for Global Health, and the program steering committee will be organized and conducted by the program steering committee. Meetings will be organized and conducted by the NCI staff on a regular basis and will require awardee attendance. The steering committee will provide strategic coordination for the activities of the UON program and be responsible for sharing and reviewing annual progress among the projects of this program. The steering committee, in collaboration with the NCI, will be responsible for planning the scientific content of the annual investigator meeting. Lastly, awardees will be expected to participate in an annual investigators meeting that may be hosted at NCI or at another location or even held virtually. These meetings will provide a forum for presenting scientific ideas from each of the funded studies and will facilitate interactions among the community of funded scientists. Applicants should budget for the principal investigators and at least one project member to attend the planned annual grantee meeting. Investigators will be expected to participate in conference calls for planning purposes either biannually or at other appropriate intervals. Investigators may also be expected to participate in collaborative working groups that meet periodically by conference calls. Funded investigators will be expected to collaborate on and report key common variables in a standardized manner. Investigators may also be asked to collaborate in the development of formative tools, approaches to dissemination, and other areas of shared investigator interest. Next, a quick overview of important dates. The applications are due December 15th, 2021, and the earliest start date will be July of 2022. Letter of intent are due by November 15th, 2021. Although a letter of intent is not required and is not binding and does not enter the review of a subsequent application, the information that it contains allows IC staff to estimate the potential review workload and plan the review. Prospective applicants should submit the letter with the following information: descriptive title of the proposed activity, names, addresses, and telephone numbers of the PDs and PIs, name of other key personnel, participating institutions, name, number, and title of this funding opportunity, and mail the letters of intent to me, Vidya Vedham, at nih.gov. Here are some additional resources that may be helpful, and these slides will be made available to everyone on the CGH website, or if you need it sooner, you can always ask me, and I'm happy to email them to you. If you have any programmatic questions, please do not hesitate to contact me. Don Mitchum is the financial and grants management contact for this call. And again, I cannot emphasize enough, please reach out to program staff and reach out to me if you have any questions. Thanks for your attention today, and I'm happy to address any questions or clarifications.